Welcome to News Panorama, coming to you live from Jos Network Center. Plateau government sensitizes residents on payment of tax. Key players in peace building brainstorm on ways to end violence in rural communities, plus health experts restate commitment to addressing animal to human disease transmission. The federal government has dismissed reports making the rounds that lawmakers in the United States have opposed to sale of military hardware to Nigeria. Information and Culture Minister Lai Mohammed cleared the air at a briefing with members of All Information and Culture Press Corps. Anthony Faustin reports.
The Information and Culture Minister, who described the said blocking of the sale of attack helicopters by the U.S. government to Nigeria by citing poor human rights record, expressed surprise as no such deal exists.
There's no contract between the federal government of Nigeria and the United States of America today, apart from the 12 Super Tucano, of which 6 have been delivered. And we are quite satisfied with the progress and the cooperation we have received from the government of the U.S. on this issue. So we are not aware of the so-called $875 million US arms contract for some helicopters, which purportedly is being withheld, or which purportedly some lawmakers in the U.S. trying to persuade the president of the U.S. not to honor.
Lai Mohammed used the opportunity to appeal to Nigerians to discard such reports as they are mere diversionary and deliberately created to distract government. He maintained that the relationship between Nigeria and the United States has remained cordial and that the United States is ever willing to support Nigeria in overcoming its challenges. In Abuja, Anthony Forson, NTA News.
President of Nigeria, Dr. Goodluck Jonathan, has advocated unity amongst Ijaw people to foster rapid development in the region. He was speaking during a consultative meeting with the leadership of the Ijaw National Congress in Yenogwa. Doris Akumonye has details.
The Ijaw National Congress and famous socio-cultural organization of the Niger Delta people, after its successful election, visited the former president, Dr. Goodluck Jonathan, to tap from his wealth of experience and ideas. Dr. Jonathan, while receiving the leadership's soul for peace among Ijaw people, has no meaningful development can thrive in an atmosphere of rancor. The former president stressed the need to have a central Ijaw language, which will be passed to the younger generation.
And bring IYC together, we must have one common IYC, we must have one common IMC. And yes, we have our differences, but we must all look towards the interests of the Ijaw ethnic nationality.
Earlier President of the INC, Professor Benjamin Okaba, said they are on a solidarity visit to the former president to seek his support. He advocated for the creation of additional Ijaw states, funding for the organization. Other issues presented by the INC president is rejection of the 3% for host communities in the PIB bill and call for resources justice, among others.
We are not satisfied with the decision of Senate on the PIB, and we are also told that the water resources bill is on the way. These are obnoxious to our people.
In Yedagoa, Doris Akomonye, NTA News.
Honesty is key in achieving sustainable peace and development. This is the position of stakeholders of Plateau State Peace Architecture Forum at a peace meeting in Jos. Ekemaran Kaneng-Ladoja reports.
The meeting drew key players in the peace-building sector, community and religious leaders from Bata, Briom, Baitiladi, Jos North and South, as well as Boko's local government areas. Issues discussed dwelt on understanding the latest trends in the farmer health crisis in the state.
We have to involve locals, the villagers. There was season any warning signals. But because they are not trained, they don't notice any warning signals. And they don't know how to manage the early warning signals.
The leaders or the two parties should be called upon and estimate the arguments. Is it true that we are making this agreement from our hearts?
For the agency and its partners and security agencies, there is the need to collectively rewrite the narrative of peace and security in a very dynamic landscape like Plateau State and Nigeria at large.
Commitment, determination, and resolve is critical to the success of peace work. I ask all to come up with their strategies that will help us. Whatever we discuss, we should take it back to our various communities.
An effective peace and justice system, ethical journalism and conflict-sensitive reportage, as well as psychosocial support were some of the recommendations from the forum that will drive a peaceful process. In Jos, Ekemeren Kaneng Ladoja, NTA News.
To boost revenue generation in Plateau State, Governor Simon Lalong is sensitizing residents on the need for prompt payment of tax to enable government discharge its responsibilities to them. Alisa Batukai Andrew has details.
The governor says the exercise is as a result of various professional analysis and assessment on the low performance of the state in internal revenue generation, despite its huge potentials, which experts estimate at 5 billion naira monthly. Hence the desire to strengthen this resolve by the passage of the Consolidation Revenue Law 2020, intensify sensitization, and improving efficiency in revenue mapping and collection in the state.
Having inaugurated the Plateau State Revenue Council as well as rejigged the governing board of the Plateau State Internal Revenue Service, we are now set to begin our sustained internal revenue drive.
Chairman Plateau State Internal Revenue Service Arad Dashi says the service will intensify meetings with ministries, departments and agencies and business community towards sensitizing and educating the populace on the importance of paying tax. The governor then visited the Plateau State One-Stop Investment Center for inspection of registration licensing and permits, hosting 18 participating agencies of both state and federal government, where he paid his ground rent on land use charge. Governor Lalong also visited other major taxpayers in the state. In Jos, Alisa Batukai Andrew, NTA News.
On 30th July 2021, the NSCDC announced 590 new cases of COVID-19 in Nigeria, with Lagos recording 380 new cases. Akwa Ibom has 54 new cases, Katsina 40, Oyo 39, Rivers 26, Niger 23, Gombe 19. Others are Ogun with 16 new cases, Ekiti 15, FCT 10, Nasarawa 10, Delta 9, Bayelsa 5, Plateau 5, Imo 4, Ebonyi 3, Jigawa 3, and Kano a single case. So far, Nigeria has recorded 173,411 confirmed cases, with 164,978 discharged and 2,149 deaths. The Presidential Steering Committee on COVID-19 PSC has warned political parties against non-compliance with COVID-19 protocols in the conduct of all political events in the country. The warning is coming on the heels of recent confirmation of more cases of the Delta variant of COVID-19 in several states and the rising number of infections and hospitalization across the country. Chairman, Presidential Steering Committee on COVID-19 and Secretary to the Government of the Federation, Boss Mustafa, in a statement cautions that political gatherings serve as super spreader events for the transmission of COVID-19 infection in communities and must be carefully controlled with the laid down protocols to reduce the risk of COVID-19 infection among the vulnerable population. All political parties are therefore directed to institute public health and social measures in all locations where political events will occur, using INEC's policy on the conduct of political events and a code of conduct for voters and political parties within the context of COVID-19. These measures include mandatory use of face masks for everyone, provision of hand hygiene facilities including soap and water, as well as hand sanitizers, sufficient ventilation of enclosed venues to be used at 50% capacity, and observance of physical distancing in every gathering. The PSC urges all political parties, INEC and state independent electoral commissions to enforce compliance with these provisions and other safety measures to protect the Nigerian population from a third wave. The Chief Medical Director, Jos University Teaching Hospital, JUTH, Professor Edmond Banwat, said the establishment of the West African Center for Emerging Infectious Diseases Nigeria project in JUTH will no doubt address gaps in the studies of animal-to-human disease transmission and prepare for emerging and re-emerging infectious diseases in the country. Ndeyang and Debagang reports.
Emerging infectious diseases are unknown or unrecognized and never occurred significantly in human population, while emerging infectious diseases are those that previously constituted a significant public health challenge and are resurfacing. Professor Banwat notes that most of these diseases are zoonotic in nature, for instance, Lassa fever, Ebola, yellow fever, monkeypox, and COVID-19, among others. They account for several deaths and are a high burden on public health, impacting negatively on human development.
It really burdens the health system. If the health system is weak, you're very sure, your population will be lost in such infectious diseases when they occur. That's a very serious impact on national development, because the workforce is affected. If your workforce, they are not coming to work, your productivity is affected, and that also impinges on the economy of that country.
This necessitated the establishment of the West African Center for Emerging Infectious Diseases, one of the 10 global consortium, and out of the 7 in Africa, there are 3 in Plateau State. The center is expected to also build human capacity.
A multi-professional kind of setting where you have specialists, doctors, you have veterinarians, you have people that specialize in birds in the Levantis Center, etc. So we're trying to say, okay, what do they harbor, for instance, that can be transmitted to human beings? So the research as a whole is for a period of 5 years. So they'll be collecting these samples across states. And that will mean a lot of data, a lot of information that will be required in case in the near future we have emerging infections.
Researches conducted in the center will position Nigeria and the world to contain future infectious disease outbreaks. In Jos, Ndeyang and Debagang, NTA News.
We have in the studio to discuss more about ways of addressing animal-to-human diseases transmission, Dr. Nathan Shehu, Coordinator, West Africa Center for Emerging Infectious Diseases, Nigeria Project, JUTH, after this break.
The vaccine offers hope for a safe country free of coronavirus. I urge all state governments, traditional and religious leaders to take the lead in the mobilization effort within their environment and spheres of influence. I similarly urge all eligible Nigerians to present themselves and be vaccinated in accordance with the order of priority already mapped out at the various authorized designated centers only.
Welcome back. We have Dr. Shehu, Coordinator, West Africa Center for Emerging Infectious Diseases, Nigeria Project, JUICE. You're welcome, sir.
Thank you.
Okay, let's begin by knowing what are emerging infectious diseases?
Well, first, infectious diseases are diseases that are caused by microorganisms or germs. And why they are referred to as emerging is because probably the infectious diseases have never been recognized, have never been detected, or even if they have been detected, it occurred in comparatively fewer number of individuals. Or probably it has occurred, but due to public health measures, it has largely been controlled. And examples of these emerging infectious diseases include this COVID-19, monkeypox, Zika, SARS, MERS. All of these are examples of emerging infectious diseases.
Okay, so why are emerging and re-emerging diseases of importance, and how do they impact on national development?
Well, thank you. You know, it's important to note that one of the primary functions of government is the health and security of individuals. And generally, people are generally concerned about the conventional security. But one aspect of security that is often neglected is biosecurity. And biosecurity is very, very important as far as emerging and re-emerging infectious disease, because you will realize that because of COVID-19, the whole world has been brought to a near halt. So emerging infectious disease is very, very important in national development because of the plethora of emerging infectious disease. First, individuals and populations are affected with the disease, and people die and develop the disease and are incapacitated to carry out productive and economic activities that will enhance national development. Number two, most of these emerging infectious diseases, they occur and may affect the health workers who would normally be there to handle other diseases that present in the hospital. So once there is emerging and re-emerging infectious disease, once they are not detected appropriately, it really affects national development.
Okay, so can you tell us what the efforts the center is making to curtail the outbreak of such diseases?
Well, first, it's important to note that emerging and re-emerging infectious disease, it is a multi-professional entity. And in order to address it, it is using the vehicle or the strategy of One Health. One Health approach put forward the need to involve multi-specialties, medical doctors, veterinarians, environmentalists, social scientists. All of these, they come together, bring their expertise together in a pragmatic manner in order to detect, prevent, and control the emergence of infectious disease. So there are several measures that contribute to the development of emerging infectious disease. First, globalization, increase in travel, because now people can travel within short duration of time. Because of that, disease can be transmitted from one continent to another. Second, overcrowding, because you have small confined space with several people that are in that space, so it facilitates the transmission of infectious disease. Third, the interaction between animals and humans. Once interaction is increased, it also facilitates the development of infectious disease.
Okay, so the center is a research-based center. What has it done research-wise?
Okay, now, the West African Center for Emerging Infectious Disease is one of the 10 centers for research on emerging infectious disease. They've been established by the National Institute of Health, which is a United States organization that established 10 centers around the world. And each of these centers have collaborating countries in at least 2 continents. And the West African Center for Emerging Infectious Disease has participating countries include Nigeria, Sierra Leone, Senegal, University of Texas, and University of Washington. So all of this, it has multi-specialties. So, and it coordinates, it operates in a pragmatic manner to detect the emergence of disease right from animals. So what the center is set out doing and has started doing is to go to check, to trap mosquitoes to see whether there are germs, to trap bats, to trap birds, to sample blood from animals. All these things, they are geared towards, because we know that diseases can be transmitted from animals to humans. So we are going right towards the animals to see even before they are transmitted to human beings, so that if there is any new disease that have been previously unrecognized, we will detect it. And also, we will also be sampling blood from human beings when they develop fever, so that to check if there is any emergence of infectious disease, it will be detected as early as possible. And aside from detection, development of human capacity development in terms of re-emerging infectious disease is important. So the human capacity development is like training people to become infectious disease investigators. Okay. To investigate and detect, and also to provide capacity for diagnosis. Because even if you develop human capacity, you have all these robust programs, if there is no diagnostic capacity to detect previously unknown pathogens, these will keep on emerging. People will be having fever, people will having this and will be dying, and people will not know.
Okay, so these are efforts made by health experts now. What do you think the people can do to complement these efforts?
Yes, it's important to note that whether at any point in time, in any village, community, or urban centers, whenever there is emergence of disease, when you see animals dying for unknown cause, it's important to report to the nearest health facility so that the animals will be sampled, their blood will be sampled to detect perhaps they may be harboring one disease or the other. So the effort of the center is geared towards harnessing all the expertise of all these multi-specialties with collaborators from the United States, so that diagnostic capacity that we cannot do, it can be done there.
Okay, thank you so much, Dr. Nathan Shehu, for finding time to be here.
You're welcome, thank you.
Okay. Plateau State Universal Basic Education Board has distributed education materials to the 17 LGAs for effective monitoring and supervision of schools in the state. Ruth Stephen Oke reports.
The items distributed is aimed at boosting logistics challenges encountered during supervisions and monitoring, as well as facilitate data processing, thereby improving quality basic education service delivery in the state. Commissioner for Education Secondary represented said the delivery of the items was timely.
These things are procured to see that monitoring and inspecting schools for effective teaching and effective learning of the young ones, that tomorrow they become useful individuals.
The Executive Chairman, Plateau State Universal Basic Education Board, Professor Matthew Sule, said in view of the current challenges being faced, there is the need to step up measures to meet with standard.
In many of our schools now, even the ones that we gave contract to for establishment or construction of new schools, they are done in the rural areas. This is to meet the yearning of the rural communities, that no child walks more than 3 kilometers to school and back in view of insecurity, also in view of exhaustion for the children.
Other stakeholders spoke extensively, hammering on the importance of education, urging beneficiaries to judiciously use the items received. Beneficiaries expressed optimism, stating that the equipment will spur them to deliver.
We are going to make the best use of it in the area of supervision of curriculum instructions. We'll make sure that we will reach out to all nooks and crannies of the local government where our schools are located.
The facilities are from the 2018-2019 2% matching grant for SUBEB. In Jos, Ruth Stephen, NTA News.
And a sad news coming from Tokyo indicates that another medal hope for Nigeria, Blessing Okagbare, has been provisionally suspended by the Athletics Integrity Unit after testing positive to a banned substance. Sports correspondent Femi Johnson reports that the sprinter, after her out-of-competition test, came back positive for human growth hormone. This is after 10 athletes were banned for not partaking in out-competition mandatory anti-doping tests. That has been Panorama from here, but remember to join NTA and stand against rape and rapists. Good afternoon.